This is the Explain Everything video for Visiting Hour by Norman MacCaig. In the first stanza, MacCaig creates an impression of the hospital setting. In the opening line, he uses the word smell. This is effective word choice as it has negative connotations. It automatically makes us think of an unpleasant aroma. The phrase combs my nostrils is effective in highlighting how pervasive the smell is, suggesting that it is strong enough to separate each tiny hair within his nose. This is used in conjunction with synecdoche. It's obviously not just MacCaig's nostrils, which are bobbing along, but the smell is so strong that it has blocked out his other senses. MacCaig completes his description of the hospital by saying that the corridors are green and yellow. These colours combine to have connotations of sickness and disease. MacCaig is there to visit a dying relative, and his view of the hospital, a place of sickness rather than healing, reflects this. Stanza 2 foreshadows the conclusion of the poem. MacCaig sees what he assumes is a dead body being put into a lift. The word corpse is harsh and blunt, reflected in the harsh C sound at the beginning of the word. Dark humour is used in the word trundled. Similar to bobbing in stanza 1, this word has light-hearted connotations at odds with what is being described. Similarly, the image of the lift shooting into the air, or the doors opening to reveal the now empty elevator cage like a magician's trick, is a darkly humorous attempt to distract MacCaig from the reason he is at the hospital, to visit a dying woman. Enjambment is used to isolate the final word in the stanza, revealing the finality of death. In stanza 3, MacCaig is trying desperately to keep his emotions under control as he travels towards his destination. Repetition is used to suggest that MacCaig is chanting to himself, like a mantra. The enjambment, or not, and feel creates a pause to allow the reader to feel the strength of the negative and to emphasise the emotions that MacCaig is struggling with. He's afraid of being overwhelmed. The enjambment on the final lines serves as a reminder to MacCaig that he must face these difficult and overpowering emotions soon. In stanza 4, MacCaig shifts his focus to the nurses working in the hospital. He is impressed by the way they're able to work day after day in such a difficult environment. The words lightly and swiftly have connotations of grace and rapid movements, implying the nurses are very busy. This is supported by the unusual syntax of the second line, which emphasises the number of nurses he sees and the quick darting movements as they move to and fro, helping patients. The repetition of "and" draws attention to their busyness. MacCaig highlights the nurses' slender waists. This makes them appear fragile and delicate, which makes the work they're able to do even more astonishingly. MacCaig describes them as coping miraculously, which shows his surprise and admiration for the way they can keep going, working in such a place, when he is struggling with a single visit. The repetition of "so," in so much pain, so many deaths, and their eyes still clear after so many farewells, highlights the suffering they must deal with daily. The euphemism "farewells" at the end of the stanza creates a sombre tone and reinforces the reason for his visit. Stanza 5 represents a turning point in the poem. MacCaig has arrived at his destination. The use of a minor sentence emphasises his arrival, and the caesura reinforces the immediacy of the situation. He can no longer distract himself or keep his emotions buried. The enjambment, in "she lies in a white cave of forgetfulness," emphasises the simple statement, "she lies," which suggests the woman is lifeless and inert. The metaphor of the cave reveals her isolation. The white colour is clinical and sterile, but also represents the colour leaching from her world as she fades into death. Her hand is withered, suggesting it is drained of life, and the metaphor of a stalk makes her hand a dying flower. She is brittle and frail, past her vitality. Again, the life is pulled from the woman's world when MacCaig suggests that her arm is wasted of colour. The metaphor "a glass fang is fixed" compares the intravenous drip to a vampire's fang. This reveals how frightening MacCaig finds all of the medical equipment surrounding his loved one. Unlike the vampire's fang, the drip is giving life, but the hard G on the alliteration conveys MacCaig's bitterness, as if he sees the medical intervention as cruel and painful. At the end of the stanza, as MacCaig approaches the bed, he emphasises the distance her illness has placed between them by using the phrases her and me and she nor I rather than us. In the final stanza, MacCaig switches perspective so that the reader watches MacCaig leave through the woman's eyes. The contrast of the black figure and her white cave show that he is bold and full of life, and so stands out, whereas she is near death and is sinking into her colourless surroundings. MacCaig's emotional state is shown through the words clumsy and dizzily, which reveal that he is uncoordinated and dazed after the emotional intensity of the visit. This is reinforced by the use of synesthesia. Using a visual image to describe a sound, when the bell sounds, allowing him to effectively drown in his feelings. The use of a pun in growing fainter continues the idea of clumsily and dizzily. In its more obvious meaning, he grows fainter rather than smaller as he walks away to show that the relative is drifting further and further from life. At the end of the poem, the woman is left with MacCaig's pointless gifts. Neither will fulfil their promise. Death is too close and she is already too far gone to make use of them. The final line, fruitless fruits, is an oxymoron. Fruits cannot be fruitless. This captures MacCaig's despair at the pointlessness of the woman's life being prolonged by medical intervention, and his inability to help her. Overall, the poem invites the reader to consider the difficulty we have facing death and the isolation of death.